Usually the answer you're given is just stick with it. Just ride it out for the vomiting and diarrhea. It'll get better. Every prescription medication comes with an insert that details potential risks and side effects. The problem is, most pet lovers never see that insert or are even informed of any potential risks before use. Whether you ultimately decide to use these medications, alternatives, or a combination of the two is your choice to make. The goal of this video is not to spread fear, but to educate and empower pet parents so you can ask informed questions and make the best decisions for your own pet. Today we are talking about Cyclosporine or Atopica. This is an immune suppressant, so I put in the description it's used for treating allergies, IBD, dry eye, autoimmune disease. In people, it's used for people who have had organ transplants. It's also used for rheumatoid arthritis or psoriasis, so a lot of autoimmune diseases. One of my holistic vet friends said she had to go to the dermatologist because she thought she was getting a little bit of eczema, and this was the first thing they said they wanted to put her on. And she's like, are you kidding me? There is no way. You know, the problem with something like Cyclosporine, this is a lot like what we talked about with the Apoquel, is that it's treating symptoms. It is not curing anything. We are not healing the body. All we're doing is suppressing everything. Side effects, I'm going to give you the quick rundown, and then we're going to go through bit by bit, just like we did with the Apoquel. Vomiting, diarrhea, and loss of appetite, which can lead to weight loss. Very, very common with this drug. Almost, well, it's a very high percentage. We'll get into the percentages, but very high percentage will have vomiting and diarrhea. And usually the answer you're given is just stick with it. Just ride it out for the vomiting and diarrhea. It'll get better. A lot of them just learn to deal with it better, and so it gets under control. But, you know, again, if we have to take other drugs to get rid of the side effects of this drug, maybe we should just get rid of this drug. Anaphylactic reactions and shocks, so they can actually have an allergic reaction to the drug that is supposed to stop allergies. Liver failure, bone marrow suppression, and kidney disease. In humans, kidney disease is a big issue with this drug. Seizures and tremors. It does cause neurologic problems. It's actually fairly common. Definitely immune suppression. You're going to get super infections. You're going to get poor wound healing. You're going to get viral papillomas. You're going to get outbreaks of Demodex. The big thing is, because we're suppressing the immune system, we'll talk about it in a little more depth, cancer. It is a known carcinogen. It is unsafe for dogs under 6 months old. Their immune system is pretty naive. It's not well formed. And so they're going to be more prone to super infections and dying. Should not be used on dogs who already have an infection. Well, how many dogs with allergies have skin infections, and then we put them on a super immune suppressant, and then it gets worse? Should not be used in dogs who have a pre-existing or have had cancer. So all those dogs with mast cell, lymphoma, whatever, and it will cause cancer, by the way, should not be used in animals with kidney disease. So you need to be monitoring and you need to check before you start the drug. Should not be used on pregnant or breeding dogs, and modified live vaccines should not be given. So that's your distemper, hepatitis, parainfluenza, parvo should not be given while your dog is on Atopica. And we do know that we see cancers related to this particular drug. This drug is made from a fungus. It's actually a mycotoxin. We have a blog on the bad mycotoxins like aflatoxins, fumonisin, those sort of things. But penicillin is actually a mycotoxin. It's made from a fungus as well, made from a mold. That's where this drug comes from. That's how it's made. So Atopica is an oral form of cyclosporine. There are generics out now as well. There's cyclosporine eye drops as well. It is an immune modulating agent, and it's produced as a metabolite of a fungus. Indicated for the control of atopic dermatitis in dogs weighing at least 4 pounds, so should not be used in the little tiny kids. And this is from the drug insert. So they're saying it should be used for atopic dermatitis, which is allergic skin disease, allergic skin inflammation. It is not labeled for IBD. It is not labeled for autoimmune disease. That's off-label usage. So the initial dose is given as a single daily dose for 30 days. Then it should be tapered by decreasing the frequency of dosing to every other day or twice a week until you reach the minimum that will achieve the desired therapeutic effect. Unfortunately, sometimes it doesn't work at all, so we just keep upping the doses instead of trying to get the doses down. It should not be given more frequently than once a day, and I have seen it used much more than that. I've also seen this used for anal fistulas. I don't use it for that, but I have seen it used for anal fistulas. It should be given at least 1 hour before or 2 hours after a meal. So if you haven't been told that, there's how it's supposed to be dosed. It is contraindicated in dogs with a history of cancer. It is contraindicated in dogs who have a hypersensitivity to cyclosporine. How would you know until you give it and they have an anaphylactic reaction? It is a systemic immunosuppressant that may increase the susceptibility to infection and the development of cancer. That is a warning on the label. For use only in dogs, which is kind of funny because they do use cyclosporine in people. This is for on the Atopica. Capsules should not be broken or opened. You should wear gloves during administration, wash hands after administration, and in case of accidental ingestion, seek medical advice immediately. Because, oh yeah, lots of kidney problems for people. Safety and effectiveness has not been established in dogs less than 6 months or less than 4 pounds, or those used for breeding, pregnant, or lactating dogs. With any immune modulation regimen, exacerbation of subclinical cancers and infectious conditions may occur. Gastrointestinal problems and gingival hyperplasia, swelling of the gums, may occur at the initial recommended dose. So these are side effects that we see a lot and very early on, even at the recommended doses. It can cause elevated levels of blood sugar, so should not be used in diabetic dogs. So they have on here, use with caution in cases of diabetes. How about we just don't use it in diabetics because we know it's going to raise their blood sugar and make it harder to regulate them. If signs of diabetes develop, then you should discontinue the drug. It should be used with caution with drugs that affect the P450 enzyme system because this drug is metabolized by the liver. We're going to talk about other drugs that it has interactions with. Should be used with caution in dogs with kidney insufficiency, or how about not at all? There have been reports of seizures in human, adult, and pediatric patients receiving cyclosporine, particularly in combination with steroids. And you should only give killed vaccines, not modified live vaccines. So a killed rabies vaccine technically could be given. In their initial field study, they had 256 dogs. 14 dogs withdrew from the study due to adverse reactions. 4 withdrew from vomiting. 1 withdrew because of diarrhea. 1 withdrew from vomiting, diarrhea, and itching, the thing we're trying to stop. 1 withdrew for vomiting, depression, and lethargy. 1 withdrew for lethargy, not eating, and hepatitis, liver inflammation. 1 withdrew because of gum swelling, lethargy, increased thirst and urination, and soft stool. 1 withdrew because of seizures. 1 withdrew because of it developed a sebaceous cyst. 1 developed because of the itching was worse. 1 developed redness over the entire body and withdrew, and 1 withdrew because of a super ear infection. Vomiting and diarrhea were the most common adverse reactions. Persistent ear infections, urinary tract infections, lack of appetite, gingival swelling or gum hyperplasia, lymphadenopathy, so swollen lymph nodes, and lethargy were the next most frequent adverse events observed. Owners of 4 dogs reported seizures while their dogs were on Atopica. This is in this initial study. New cases of ear infections, allergic ear inflammation, or redness of the ears developed while dogs were receiving Atopica. Yeah, the thing that is supposed to be curing. Out of the 265 dogs, 31% had vomiting. That's a lot. 20% had diarrhea. 7% had persistent ear infections. 4% developed urinary tract infections. 3% had anorexia or lack of appetite. 2.5% lethargy. 2.5% with a gingival hyperplasia. 2.5% with lymphadenopathy. Other side effects reported included constipation, flatulence or gas, clostridial organisms in the feces, nausea, regurgitation, increased thirst and urination, strong urine odor, protein in the urine, itching, redness or flushed appearance, skin infections, crusty skin disease, excessive shedding, coarse coat, loss of hair, papillomas, histiocytoma tumors, granulomatous masses or lesions, epulis, which is a mouth tumor, multiple hemangioma, seizures, shaking, trembling, hind limb twitch, panting, depression, irritability, hyperactivity, increased light sensitivity, reluctance to go outside, weight loss, and hepatitis. This is like those commercials on TV. May cause. in that little soft voice at the end, and they talk really fast. So as far as blood work goes, out of those 265 dogs that were in the initial trial, 8% had elevated creatinine, which is kidney function testing. 6.5% had increased globulins, which is a protein that basically signals inflammation. 5% had increased phosphorus, 3.5% increased protein levels, 2.5% increased cholesterol, 2.5% low albumin, which is made by the liver, 2.5% low calcium, and 2.5% elevated BUN, which is a measure of kidney function for the most part. So they also in those dogs saw increased sodium, increased potassium, increased liver values, ALT, alk-phos, increased chloride, and calcium. That was the original study to get the drug approved. So they had all these side effects, all these levels really high, and they got it approved. So this is the post-approval experience on the veterinary label. And remember, this is what's been reported to the FDA. And remember, only about 1%, and I didn't look up how many have been reported. I'm sure it's a lot. Only about 1% actually get reported. So for gastrointestinal system, vomiting, diarrhea, the gingival hyperplasia, hemorrhagic diarrhea, abdominal pain, vomiting blood, digestive tract hemorrhage, retching, gas, tenesmus, which is straining, digestive tract hypermotility, dark tarry stools, pancreatitis, involuntary defecation, love that, general lethargy, anorexia, weight loss, increased thirst, increased fever, pale mucous membranes, general pain, collapse, dehydration, edema, skin lesions, itching, dermatitis, eczema, hair loss, redness, papillomas, bacterial skin infections, skin and or appendage cancers, pigmentation disorders, hair change, hyperkeratosis, which is thickening, excess keratin, which is like skin laid down, particularly on the paw pads, histiocytomas, fungal skin infections, dermal cysts, behavioral, hyperactivity, behavioral changes, anxiety, vocalization, aggression, inappropriate urination, disorientation, neurologic, muscle tremor, seizures, ataxia, which is a wobbly walk, and paresis, which is partial paralysis, respiratory tachypnea, which is rapid, shallow respirations, dyspnea, which is struggling to breathe, and coughing. For the urinary system, increased urination, urine abnormalities including bloody urine, urinary tract infection, protein in the urine, sugar in the urine, decreased urine concentration, urinary incontinence, cystitis, renal failure, kidney failure, and kidney insufficiency. In the immune system, they saw hives, anaphylaxis, and allergic swelling. In the blood and lymphatic system, we've had reports of lymphadenopathy, anemia, hypoalbuminemia, which is the low protein, and leukopenia, which is a decreased white cell count. They say it doesn't affect the bone marrow, but yet we have reports of decreased red cell and white cell production. Elevated liver enzymes, hepatopathy, hepatomegaly, hepatitis, which is basically a big swollen angry liver, lameness, limb weakness, and muscle inflammation. Ear infections, tachycardia, which is a racing heart, diabetes, and high blood sugar, and in some cases, death and euthanasia has been reported as an outcome of the adverse events listed above. No shock there. Cancer has been reported in dogs taking Atopica, including reports of lymphoma, lymphosarcoma, and mast cell tumor. Diabetes mellitus has been reported. West Highland White Terriers are the most frequently reported breed, and West Highland White Terriers happen to be a breed that really loves to have environmental and food allergies. It's an immunosuppressive agent that has been shown to work via suppression of the T helper and T suppressor cells and inhibition of interleukin 2. Those are white blood cells, the lymphocytes that are the immune system. It is extensively metabolized in the liver, to a lesser degree in the gastrointestinal tract and the kidney. Here's what's really interesting. 74% of Atopica-treated dogs showed improvement in their itch scores over the first 30-day period. So 26% of the dogs, it didn't help. And we got all these side effects. I don't know how this thing got on. In a 52-week oral study, they gave different dose levels. They saw vomiting, diarrhea, weight loss in all levels of treatment. The side effects increased in frequency as they increased the dose. Papilloma wart-like lesions of the skin were observed in 5 out of 8 animals between weeks 20 and 40. Other findings in this study included swollen gums due to chronic gingivitis and periodontitis, lower serum albumin, higher cholesterol and triglycerides, anemia, decreased white blood cell counts, lymphoid atrophy, so that's their lymph nodes, that's part of your immune system, so they just kind of shriveled up. The maximum recommended dose when administered for 90 days causes callus-like lesions on the foot pads, that's that hyperkeratosis. Red, swollen ears, mild to moderate gingival proliferation, that's the gums. Hyperkeratotic areas on the skin, so you can get these plaques on the skin as well. Hair loss, salivation, vomiting, diarrhea, abnormal stools. And then when they went to the higher doses, then we got enlarged lymph nodes and weight loss. Proliferation of the gingiva, the gums, and the toe pad epithelium was seen in all Atopica dosed groups. Okay, so let's talk about drug interactions with this. Some drugs are going to increase the concentration of cyclosporine in the blood, in the body, in the bloodstream, and others are going to decrease the concentration and make it less effective. Antibacterials that are going to decrease its effectiveness include clindamycin, sulfadiazine, and trimethoprim, which is a sulfa drug. So we got 2 sulfa drugs and clindamycin. So if your dog is on this drug and is put on antibiotics, you need to ask what you need to do. Do you need to increase or decrease one of the drugs? Antibacterials that may increase cyclosporine concentration. This is a longer list. Azithromycin, chloramphenicol, those 2 are not used that often. Ciprofloxacin, that's used a lot. Clarithromycin, not used as much. Enrofloxacin, that's Baytril, that is used a lot. Erythromycin, not used that much. Metronidazole. So let's see, your dog gets put on Atopica, and then he gets diarrhea, so your vet turns around and puts him on metronidazole for the diarrhea, and now our cyclosporine concentration is being increased in the bloodstream, causing more side effects. Let's see, antifungals, all the azoles, fluconazole, itraconazole, ketoconazole are all going to increase cyclosporine concentration. A lot of these dogs either have or will develop fungal infections and will be put on an antifungal drug. And so that's going to change your cyclosporine concentration. Decreasing cyclosporine concentration is terbinafine. That's not used very often. Gastroprotectants. And so these are drugs and gastroprokinetics. These are drugs that are used very commonly as well. Cisapride, omeprazole, cimetidine, which is Tagamet, and metoclopramide, which is Reglan, will increase cyclosporine concentration. Famotidine will decrease cyclosporine concentration. Other drugs that will increase it include calcium channel blockers. These are our heart dogs, digoxin, estrogens, and flavonoids in grapefruit juice. Not too many of our dogs drink grapefruit juice or eat grapefruit, but it is important for people who take this drug. Drugs that may decrease the cyclosporin in concentration include azathioprine, which is another immunosuppressive, phenobarbital, which is an anticonvulsant, phenytoin, which is an anticonvulsant, and cyclophosphamide, which is a chemotherapeutic drug. So there are drug interactions, and you need to ask about those if your animal is taking this. And it is used in kidney transplants to any organ transplant to suppress the immune system. Hugh's sister-in-law had a kidney transplant and was placed on all these immunosuppressants, and within a year had cancer, which took her life. So pretty bad news. So Atopica is not near as popular as it used to be because Apoquel came on board. And they said, oh, well, good, Apoquel has a lot less side effects. Yeah, we talked about those the other day. We still got some serious side effects going on here, folks. So if you're using this as an eye drop, the eye drop tends to be a little more localized. You're not gonna, it's a low dose, you're not absorbing as much, but I'm a much bigger fan of tacrolimus for a dry eye drop than I am for cyclosporin. I got really away from this stuff. Okay, I'm gonna get going.